Hi everyone. We're very excited to be talking all about anxiety and depression tonight with very special thanks to my friends at This Herb. It is a topic it's kind of dear to my heart. I know that for various reasons, each and every one of us can experience some type of anxiety or depression at any time. And while some of us have a diagnosis or some type of, clinical confirmation that we have challenges in this area, there are certainly others that don't. And so if you are watching this right now, you know of somebody who is suffering from anxiety, depression, or some type of emotional disorder, or just not feeling good, then please can you do me a favor and share or invite them or tell them that we're going to be here for the next 30 minutes or so talking about this topic, which is huge. It's a huge topic, and one of the things that I think is really important is to understand not just what's happening physiologically in the body, but also look at some tangible tips and tools that you can utilize to help to improve your body's own function. And I think too often we don't talk about anxiety or depression. It's whether it's embarrassing or not you or me too, or we just we're mimicking the role of generations before us where we have to be happy all of the time. And the reality is we're not happy all of the time, and it's okay to not be happy all of the time. So if you're just joining in now, please can you invite anyone who wants to come and join us talking about anxiety and depression and emotional disorders, because it is a really real topic. It's happening to so many of us, and unless we talk about this, we are never, ever going to make inroads. And the reality of that also is that we're all in this together. So again, also one thing I have to say is I absolutely love love hearts. I love thumbs up. And I also love when you interact and ask questions. So ask your questions here. I can see some questions coming through. That's perfectly great and fine, and I will get to those. But let's just dig straight into it, because I can see a question already about thoughts on antidepressants, and we'll get to that very quickly. So I got some statistics for you. Currently, there are 264 million people worldwide that have been diagnosed with depression, and 284 million people, I'm laughing because it's not a laughing matter, it's reality, right? We are experiencing this at an all-time high worldwide, who are suffering from anxiety. So Beyond Blue suggests that there are over 3 million Australians living with anxiety or depression. And I think diagnosis is absolutely at an all-time high, and we need to talk about why. So why I'm really excited and I'm very passionate about talking about this, we have to give special mention to This Herb, who have made this webinar possible. And I'm really also very excited to say that I am very proud to be their brand ambassador and to be able to talk more about and integrate more Chinese medicine, Western medicine, bridge the gap, give you information that is truthful. The feedback from you guys is you want more information about Chinese medicine, which actually blows my mind, because whilst that's my craft and what I do, so many people, I feel, want a scientific explanation. And whilst Chinese medicine is 3,000 plus years old, it totally integrates into Western medicine, which I love. And how smart is it that something that is 3,000 years old is actually able to integrate into something that is modern and current. And this is the reality when it comes to anxiety and depression. We're seeing it more than ever because it is a consequence of our modern day lifestyle. It's a modern day living coupled with changes in our neurotransmitters, our brain chemicals. There's lots of reasons why we're seeing this, but it definitely is at an all-time high. So we absolutely need to talk about this. I'm just looking at what people are commenting already. We'll get there. All right. So, once upon a time, all mood disorders were kind of clumped into the one area. It was like, okay, you have some type of imbalance, you have some type of mood disorder. And really what we've discovered is it's so intricate, and that is so not the case. And we can really start to categorize various types of emotional or mood imbalances to allow us to treat it more accurately. And I think that's really important, because if we are putting everybody, it's like IBS. You're being diagnosed with irritable bowel syndrome. What in the world does that actually mean? Like, does that actually really help you in treating your condition? It doesn't, because it's just a syndrome. It's a group of symptoms. It's like PCOS, a group of symptoms all clumped together, and you're left going, okay, well, that's great. You've given me a label, but does that actually help me when it comes to working out what to do next? And no, it actually doesn't. So we're specifically talking about depression and anxiety, and I have some notes here because I don't want to miss anything, but let's talk about this. So anxiety is characterized by, actually, let's go with depression. Depression is characterized by issues with mood, low mood for an extended period of time that's at least 2 weeks. Of somebody, you go to your doctor and you say, I have been feeling so low, and it's been longer than I care to admit. And, it's also characterized by issues with sleep. Maybe it's either insomnia, so you can't fall asleep, or you fall asleep fine, but you wake. And we're going to talk about waking, but you wake at certain times, or you wake throughout the evening, you can't stay asleep. As a result of that, then you have fatigue. But there are also a group of people who are suffering from depression that all they want to do is sleep, and they actually can't get out of bed. They want to sleep for long periods of time because they just don't want to face, the world. And rightly so. If you feel like crap, why would you want to face the world? It's also marked by changes in appetite. And again, I love this because it might be overeating, it might be undereating. It depends on you. And this is something I'm going to talk about as well. Chinese medicine characterizes this so well, because we look at whether or not it's over or under. We look at whether or not you need to sleep more or you're not sleeping. It's not one group of symptoms to treat something. And so other symptoms include difficulty concentrating, inability to make decisions, not feeling like there's mental clarity, and that can also lead to more harmful issues of self-harm or thoughts of suicide. Now, again, like I said, these are all seen alongside low mood for an extended period of time. Don't forget, guys, if you've got people that might be interested, please invite them on to join us. Please tag any friends. Like I said, I love hearts. I love thumbs up. I love any of that, because it's just like, yep, I guess I need validation. So that characterizes depression. Then we look at anxiety. So similar symptoms in the sense of low mood, but anxiety is more about overwhelm. Whereas depression, I think it's not underwhelm. It's just this low, really low level of motivation, inability to concentrate, just like, I just want to escape. Anxiety is more about this overwhelm and pressure. It does result in some similar symptoms. So it can affect your sleep in a similar way. It can affect your appetite in a similar way. But anxiety is generally more a result of excess stress or lack of sleep, which is also excess stress. But even things like thyroid issues can cause anxiety over a period of time. So really looking at contributing factors and, really asking yourself, do I actually feel overwhelmed, or do I feel like I am so low, I just want to escape the world? And, I think what's also important is that self-diagnosis in these circumstances isn't what we're going for by any means, but you can generally get a sense and then be able to talk to your healthcare professional further about what's actually going on for you. So, we are definitely living at a time where anxiety and depression is at an all-time high, I believe. And why is that? I think we're living at a time where we have to constantly be on, constantly motivated, constantly, someone said having both is the perfect storm. Yes, absolutely. You can actually have both. Of course you can have both. We're living in a time where we're always on, we're not taught to wind down or sit down at night and relax. We constantly on our phones. There's emails constantly coming through. There's this absolute overwhelm. The pressure of daily living is reportable. Like it's something we can't deny. And so I think that absolutely contributes. We also are spending a lot of time on our screens, which absolutely interrupts or disrupts our melatonin and, does contribute to whether or not we can sleep properly. So, many of us go to bed with our phones and we watch them until the minute we get tired and then turn them off. Unfortunately, that blue light from our screens, it actually raises our cortisol. It pulls the brake on our melatonin, and that can be definitely a contributing factor. So moving away from that obviously is something we need to look at. Even just being stressed and overwhelmed from deadlines or work, or, how many patients I see that they're like, oh yeah, I work full time and I study full time. It's like, oh my goodness, and you're a human. Like, there is not time for this without it having a consequence. It takes its toll. And if you are feeling stretched to no end, you have to look at these factors. There can also be things like traumatic events, whether it's some type of previous history of trauma or abuse. For many women, it's really it's very real when it comes to postpartum, although we also need to look at, a lot of women are being diagnosed with postnatal depression, but they're actually just haven't really been able to very well transition into motherhood, and that's not their fault. And I'm not saying you're not doing a good job. I'm saying that there's this realization that you've all of a sudden been split in two. You are you and you are a mum, and we're not talking about this, and that becomes a factor too. And then, of course, there's chemical imbalances. So, not enough certain neurotransmitters to actually or our neurotransmitters being out of balance. So whether this is, serotonin, dopamine, or adrenaline, whatever it is, norepinephrine, whatever that is for you, it really is important to get that proper diagnosis and work out exactly what's going on. And there are also other factors which we're still exploring, things like GABA, glutamate, the list goes on. I think GABA is a really big one and can be an amazing, we prescribe it in the clinic all the time, but if that is definitely something that is out of balance for you, or it's not being released properly, then that's definitely something that we need to look at. But science is still trying to figure this out. We still don't actually know, and that becomes a fact too. So I think we need to look at, from a Western perspective, how we treat this. And obviously someone asked the question about antidepressants already, and I really want to talk about that. But, there's lots of questions actually. I'm just looking. Such a great explanation of the difference. Thanks, Jessica. Definitely, I think we need to look at antidepressants are there to help regulate our neurotransmitters. And so if we are finding that they're out of balance, if there's not enough, if there's too much, then they're there to help to regulate. Traditionally, we used various antidepressants to obviously balance things out, but unfortunately the side effects are definitely wide and varied. And so, when we are seeing these various imbalances and we're not necessarily looking at the root cause, I really think antidepressants play a role, absolutely, but are they a long-term viable solution? Probably not, because they don't actually address the root cause. And until we actually address the root cause of why this is happening for us, then we're always going to be reliant on these things and possibly never have to actually face what's going on. The only way we can, you've heard it 1,000 times, we can't go around our emotions. We have to go through our emotions, and that can be totally confronting for so many people. So there's various types of antidepressants, and the more modern antidepressants definitely come with less side effects, less effects on things like histamine and histamine reactions. However, they absolutely still have side effects. And I think one of the major problems is any medication, whether it's an antidepressant or otherwise, definitely affects the microbiome. And what we're learning about our microbiome, that is our gut bacteria, that's what lines our skin, our body, everything, our digestive tract. The bacteria that's found in the microbiome absolutely impacts the way that our body works. We know that it actually influences our genes. So if certain bacteria are either overgrown or there's not enough, those messages, that role that they have isn't necessarily performed because it's not able to do that, or it's overperformed. So really looking into this is definitely the way of future medicine. But this is what I love about Chinese medicine, is it appreciates that the gut is the epicenter of your health. And if your gut isn't working properly, whether that is an overgrowth or an undergrowth of bacteria, maybe you've cleared it out because of medications or antibiotics, and at the same time you can have an overgrowth because it's like, it's like chopping down all of the trees in the forest and then releasing all the bunny lambs and the snakes. Bunny lambs? Bunny rabbits and snakes. If you're just releasing 2 or 3 different varieties of fauna, that's not going to work, and it takes time to grow this diverse ecosystem that all works together. If you just have species of snakes and that's it, that's not going to actually be a flourishing forest. So just looking at it in that way hopefully makes some more sense. But it's not to say that you shouldn't use these medications, but long term they absolutely have an effect on the body, and they potentially have a negative over time, a negative effect on the body, and really don't take us where we want to go, and come with a whole heap of side effects. So not only do they have effects like dry mouth, dry eyes, fatigue, but we also see other symptoms like agitation, anxiety, which really blows my mind, because if you're taking antidepressants because you are depressed and have anxiety and it amplifies your anxiety, it's really time to look at some other solutions. We can look at other side effects like nausea, weight gain, low libido, fatigue, drowsiness, and then, like I mentioned, absolutely having its way with your digestive system. So, like I said, like any medication, short term, sure, let's get some relief. But long term, we have to look at what else is going on to really make inroads. And this is where I love what Chinese medicine has to offer. Chinese medicine, it can be really tricky to get your head around. I'm going to give you a quick 101 on the emotions, and it's so much deeper than this. But in the short amount of time we have, I think it's really important that we understand. And so when we talk about the mind in Chinese medicine, we refer to vital substances of the body, which sounds really strange, but we're talking about, we call the spirit or the soul the Shen in Chinese medicine. The word Shen actually translates to spirit. We all have that. You hear people talk about a young child and say, well, they're very spirited, but we all have that essence about us. We all have that energy about us that makes us who we are individually. And we call that our soul, our spirit, our Shen. And it's going to be different from person to person. But from a Chinese medicine perspective, your Shen activates your mind, your thinking, your consciousness, your awareness, your ideas, your motivation, your memory, your insight. It's all of that. And we talk about the role that the heart plays when it comes to Shen. We say that the Shen resides in the heart. So when you go to sleep at night, your Shen comes in, it rests in your heart. You wake up in the morning and it comes back out again. And for this reason, the heart in Chinese medicine plays a massive role when it comes to our emotions. Now, this is difficult to translate, and we're talking about Chinese medicine and Western medicine. So we're probably talking more about the mind and the brain when it comes to a Western perspective, but when we're talking about it from an Eastern perspective, we're talking about the heart. And we're just talking about an energy. We're not necessarily talking about an organ as such, but an energy more than anything. And if you can try and put away your Western mindset for a second, and I know I had to do that because my background was science as well. When you marry the two together, you get this absolutely beautiful diagnosis and treatment, which is second to none. So, like I said, we say that the Shen resides in the heart and it is responsible for many activities: sleep, thinking, ideas, like I said, memory, intelligence, wisdom, as well as the 5 senses. So smell, sight, hearing, taste, and touch. It's big deal. It's a really big deal. So if you think about this, you know, the mind, in cases where we're overwhelmed or we're depressed or we're anxious, try and say depressed, anxious, and overwhelmed all together. We can see when there's an imbalance, it becomes really difficult to think. You know, we don't have a good memory, we can't remember things, or we're halfway through a sentence and then we stop and we're like, I don't know what I was doing. And I do this all the time, totally. As well as insight, and then of course sleep. It's dependent on your stress levels, your state of mind. When we're calm, we sleep better, and when we're not, we don't, and we can wake up at certain times. And if you are waking at the same time every night, I encourage you to look at the Chinese medicine, or the Chinese medicine clock, which tells you when your qi, which is your energy, is most, or which organ it's flowing through at that time. And if you're waking at the same time every night, you can start to see this absolute connection between which organ is involved in your imbalance. Now, like I said, from a Western perspective, we totally associate this with the brain, but what's really interesting is that we can absolutely make that correlation. You know, if we are experiencing all-time stress, we don't sleep. Same as in Chinese medicine. If our Shen is disturbed, we don't sleep. In Western medicine, if our mind isn't clear and we are suffering from anxiety or depression, we can't think. So it's exactly the same thing we're talking about. So the heart absolutely plays this role, where the heart is said to really govern all of our emotions, and it is the overarching or ruling organ we use when it comes to treating that. And then there's the liver. All organs play a role when we talk about Chinese medicine, but the other major organ is the liver. The liver plays a big role in emotions as well. It's said to regulate your emotions. So it's different from the heart, which governs emotions. The liver regulates the emotions. And I guess the most common thing we see when we have a lot of stress and pressure when it comes to your liver, and your liver from a Chinese medicine perspective, is that your emotions become stuck. So because the liver is in charge of regulating or soothing, we say, emotions in Chinese medicine, you know, over time, if we experience long-term anger or frustration, then we can start to see it affect the liver energy. What I didn't mention is that every organ has an emotion attached with it. So the liver is anger or frustration, the spleen is worry, the lung is sadness or grief, the kidneys are fear, the heart is hatred, and have I left anything out? Spleen, worry. They're the main organs. And so if there is a dominant emotion, if you find you're worried all the time, spleen is like the gut, by the way. So you know, we might look at the gut health. If it's anger, we might look at the liver. If it's hatred, we look at the heart. So it just starts to help you from the other way around. If you're like, I am angry so often, then we would look at the liver. Or I am worried so often, we would look at the gut, if that helps to make sense. So the liver is commonly associated also with the emotions, especially depression and alternating moods, but also irritability, being easy to anger, frustration, also commonly insomnia. And also when the liver is deficient, we can see other symptoms of dizziness, numbness, not being able to concentrate, even cramping. I think the other thing to really raise awareness is the liver is absolutely responsible also for, the liver is almost always affected by stress. All organs are, but especially the liver, and it can really stagnate the energy of the liver. And the other thing I want to say is that other medications, so like the pill, absolutely from a Chinese medicine perspective stagnates liver function, and the liver is definitely associated a lot with menstrual irregularities or issues. Other symptoms that can be associated with the liver, the outward projection of the liver is also the eye. So eye issues, blurred vision, dryness of the eyes, itching, irritability, but also headaches, like I said, being easy to anger, and issues with menstruation. So when the emotions become stuck, we need to look at ways to help to I guess we say open or promote the flow of blood and qi in the body. I think it's easy to see that emotions over a long term can affect all of the organs. So if you're experiencing any of those emotions that are dominant all the time, then you absolutely need to look at that. And this is where, like I said, this whole aspect of bringing in Chinese medicine can become really beautiful, because it explains the unexplained. You know, if you are suffering from anxiety, but you haven't looked at any of those other factors, then you can kind of be left going, well, I don't really know what to do about that. I just know that I have anxiety. Whereas Chinese medicine looks at that and says, okay, well, what's the dominant emotion? How can we regulate that better? And definitely looking at the heart and the liver, they both play massive roles. We can look at other symptoms as well, and this is where this speaks true to me and in the clinic, especially when it comes to reproductive function. Fertility challenges and menstrual issues are also a big factor, or an extended factor, of long-term emotional issues as well. So if you're experiencing issues with fertility or your menstrual cycles, then that's definitely somewhere you can look at. When we come to using Chinese medicine to treat these types of issues, we have two main ways of doing that: acupuncture and herbal medicine. Now, acupuncture obviously requires you to go to your acupuncturist or your person that can do some type of meridian therapy to really open up the channels. What's wild about the channels is they've researched them over recent years, and if they even insert dye and take X-ray or some type of visual on that, the meridians that we speak of that are over 3,000 years old actually exist in terms of pathways within the body. They're generally spaces between tissues, muscles, tendons, bones, and they are a pathway from an organ, usually down an arm or leg, and this is where we use acupuncture to manipulate how the organ works. So that is one mode, but the other key way of doing this is through herbal medicine or plant-based medicine. And, you know, so many of our modern day treatments are based on plants, and that it's underestimated. I really think it is, because if you don't know what you're doing, you really, you know, there is the medicines or the medicinal components of plants can be really, really powerful. So when it comes to using certain ingredients to help to manipulate or support or change our moods, plant-based medicine can play a really big role. And this is where I'm really excited, because, you know, my friends at This Herb have created the most incredible product, and I'm going to show it to you, Sunny Pills. This is how they come, to help to support and regulate your emotions. Now, I'm going to, in a second, I'll give you a couple of case studies, but what I love is that the ingredients in Sunny Pills is so safe. It's TGA approved. It's so safe it can be used with other, mostly, always check with your healthcare provider, but with other medicines. And it definitely contains ingredients to help to promote maximum body function. So really safe ingredients, things like guizhi. So I only know the Chinese names of these, but cinnamon is absolutely an ingredient that helps to support blood circulation and definitely uplifts mood. Ginger, so we call that, it's called ganjiang in Chinese medicine, is definitely also important for, I can't get that right, for its anti-inflammatory properties, and again helping with mood and circulation of the body. Another really awesome herb is wu wei zi. Wu wei zi is a fruit called magnolia berry, and it helps to boost liver function and support the adrenals and your energy. These are just some of the ingredients. There's lots and lots of ingredients in here. I'll mention one more. Swanzhou ren is commonly used. It's a dry fruit. It's kind of tasty. It looks like a little tiny apple almost. And it also has a sedative and anti-anxiety effect on the body, because it also works on the heart. So herbs in Chinese medicine will work on the meridians, and often it's more than one. So it'll enter the meridian and then affect the organ, which I know sounds really interesting. But it's not just one herb. It's the sum of all of the ingredients, and there's about 12, 13 ingredients in this that are all Chinese medicine based, that go to work not individually, but the sum of the whole that changes the way that the formula works. So it's not just that single ingredient, but when you add 2 or 3 together, it kind of changes the way that it works on the body. And this is what I love about Chinese medicine. So when it comes to choosing the ingredients. You don't just choose ingredients willy-nilly. We're taught as herbalists to really be able to create a very well-balanced formula that enters certain meridians, that has certain properties and acts on the body in a certain way, not just for the individual properties of a herb, but the synergy of how they all work together. And this has definitely been beautifully crafted to do that. So I want to make special mention, though, like all medicines, it needs to be used with caution, and you definitely should speak to your healthcare provider. There can be, the beauty of this is, when it comes to herbal medicines, there can absolutely be interactions, and your GP or your doctor isn't necessarily going to know that, because they're not a herbalist. Unless you're seeing an integrative doctor or someone who is a GP and a naturopath, that's not their job. And that becomes really tricky, because they've got your best interest at heart with their knowledge, and they're going to say, do not put those two together. So seeing somebody who can actually speak to this and understand this becomes very important. When would this not be appropriate is when you're unwell. So if you have a cold or a flu, in Chinese medicine, we say we must treat the acute condition. So if you had nausea or vomiting already, then we'd say, let's hold on that, use this when that's not there. But plants are really powerful, just as powerful as any other medication. And so we need to be mindful of that. So you don't just use it willy-nilly, and you definitely don't take extra dose. You use this exactly as it's prescribed. It is TGA approved. The thing I love the most about it is that it can be safely used with other things like IVF. And the results, I'm going to speak to that in a second, utilised in conjunction for fertility and IVF are outstanding. So when it comes to treating, this is one tool I think we need to be really mindful of is, or when I say mindful, it's really useful. It is a tool that we can use to help to treat depression and anxiety, because it goes to work to treat all of those things that we were speaking about when it comes to the heart and the liver, and that becomes really important. Some other things that you can start to look into when it comes to treating anxiety and depression are things like fasting. Definitely look into fasting. Fasting, when you're not eating food, all the other things that your gut gets to do whilst you're not eating, especially when it comes to making your feel-good hormones like serotonin and dopamine, it's something like 90% of those are made in the gut. So when you're resting your gut, by not eating, it gets to do all those other things as well as recovery and repair. Sleep hygiene becomes really important. So setting up a healthy sleeping environment, not having your phone in your room, having a shower, maybe reading a book before bed, and really trying to invest in quality sleep. Checking in with your stress. Stress is the cause of so many of these things we're talking about. And so it might not be the only thing, but if you already have some type of history of trauma or chemical imbalance and your stress, it's going to make that worse. And without doubt, nutrition. We cannot second guess when it comes to nutrition. There is absolutely no way that we can do that. Now, just to wrap up with when it comes to the Sunny Pills, I just want to give you an example of a case study, especially when it comes to fertility, because this is obviously my area of expertise. But I need to find the one that I wanted to talk to you about. But there are many case studies that this herb have done when it comes to looking at fertility and how we can integrate and use something like Sunny Pills alongside other protocols. So let's use this case here of a patient who was in her 30s. She had infertility for 10 years after a miscarriage. She was anxious, depressed most of the time. She was stressed. She had a lot of worries, and her period was abnormal. In Chinese medicine, we feel for the pulse. So her pulse suggested that she was quite deficient. And so she was prescribed Sunny Pills and acupuncture, and she was visiting the clinic weekly. The results were that very quickly she naturally conceived. Let me look at the date here. Her initial consultation was in May, and by August, she had conceived after using the Sunny Pills, which is really, really awesome. And is just one example of many that we have of women that infertility for many years, couldn't conceive, highly stressful lives, a lot of worries is another one that I'm looking at here. And within 3 months of treatment, she got pregnant naturally. So natural fertility, Assisted conception, it's still very appropriate for all of these things. Not only is it great for women who are experiencing fertility challenges, but also for men to increase sperm quality. And that's because it goes to work on sorting out that emotional aspect of our health and really supporting our body on the whole. And you can't separate emotional from physical. They are definitely intertwined. Every function in the body is intertwined. You can't separate your reproductive system from your endocrine system, or your immune system. They all rely on each other. So that becomes really, really important to look at the whole picture. I need to see if there's any questions here, because I know that we're well into our time frame. I'm one of your clients, Nat, so I might ask you some questions. Absolutely, please. Sorry if this has been asked, but can these herbs be used in teens? Yes, they absolutely can be used in teens, and that will be really, really useful and very safe. Can this be used with happy hormones? Yes, it can be. The product Happy Hormones. More screen time, more stress. Yeah, so I think that there's not that many questions here, but what I would absolutely love is that if this speaks true to you, or you know anybody who might benefit from watching this live, obviously this will exist on both my page and the This Herb page that you can refer back to. But truly, the one thing that speaks true to me is not only is Chinese medicine like my jam, but something like this actually exists without side effects if you're using it properly, and that becomes really safe, really effective, and something that you can utilize generally along other medications. Of course, always speak to your healthcare professional. They're going to know best if you're worried at all or you need some more clues into this. But I'm really excited to be able to talk about a product that has a lot of integrity, a lot of research, and was developed by a very, very, very clever doctor who absolutely knows their stuff. And so, looking for other simple tools, it's hard to break the stress cycle. But when we can find simple alternatives or additions to our daily lifestyle, it can start to break the sequence or the chain of events that contribute when it comes to everything that's contributing to our emotional health. So I'm very, very grateful for you watching tonight. If you do have other questions and you're watching a replay, please post them here and I'll come back in and answer them for you. Make sure you absolutely share this with other people, because I think the other issue is we just don't talk about it. We don't talk about it enough. It's like it's this taboo topic that it shouldn't be. So since there's no other questions, hang on. Yes, so it says, is the list of ingredients on the website? Yeah, absolutely. So if you head to the This Herb website, then you can look at the list of ingredients. It's difficult because your doctor's not a herbalist, so they're not going to generally know, but that's where I'd say speak to a herbalist that absolutely can speak to that for you. Someone like myself, that's my job, is to know how this interacts with other medications or other formulas, and it can be confusing, but it is very safe generally outside of those other things that I spoke about. All right, guys, thank you for listening. I really appreciate it. If there's any other questions, please ask them here. Let's keep talking about anxiety and depression. Let's remove the stigmatism around it, that it's something that look, you saw the statistics. It's like 3 million Australians are experiencing this. We have to talk more about it. We have to be more open about it. So make sure you check out the formula on the This Herb website. Like I said, ask any questions you have, and thanks for joining me tonight. I absolutely appreciate you being here. The thumbs up, the love hearts, I totally appreciate it. See ya.